first of all, I want you to look at this title screen that I put together, kind of just to draw your attention over to the top left corner, or your top right there, where we've been seeing more and more articles also come up with the title "Medi-Cal Patients Sue." Now that's kind of an image that I want you to keep in the background as I go through this recommendation, and then we look at what that title, how it ends at the end. And so my talk is titled, "Do Socioeconomically Disadvantaged Patients Sue More Often Than Others?" And to look at this, I wanted to see what the background is behind this idea. So not all physicians believe that low-income patients or those that are more disadvantaged will sue more often, but there is a good group of physicians that do. And so one of the best studies that I found in the literature was a survey that was put together by 3 physicians in University of California, San Francisco. And they did a survey in 1993 that was published in 1995 in the Western Journal of Medicine, where they were able to find that 120 out of 124 general practitioners that were surveyed, there was a perception of an increased risk of being sued was cited by 57% of these physicians as an important decision in not to care for Medicaid patients, and also by 49% of physicians in not caring for uninsured patients. So this is the article. It's interestingly titled "California's Physicians' Willingness to Care for the Poor." And it was the survey was put together after getting a cohort group of physicians where they kind of had a focus group, and they would kind of meet together and come up with questions of what they should ask in this survey. They ended up sending out in the mail 300 letters out to physicians, and ultimately only about 170 or so replied back. But looking at table 2, you could see that there was a perceived increase in malpractice risk from a variety of the respondents, and so it would keep them from wanting to provide care for this patient population. And one of the patients that was quoted in this study essentially said, "Your risk of being sued for malpractice by Medicaid patients is greater, as they have multiple problems you don't know anything about." Another population and another study that kind of also pointed out that there's a fear of lawsuits is the obstetrics population. And interestingly, the data that I was able to find was mostly collected in California. And in this case, the study was triggered because in Sacramento, they were noticing an increased rate of women showing up to deliver babies in these hospitals without ever having seen a single physician. And they surveyed and asked these women, what's the cause or the reason why you weren't able to see someone? And the majority said they just couldn't find someone that would accept them with their being a Medicaid patient. And so they also surveyed some of the local obstetricians in that community. In this case, it was a really small study, but it was ultimately 7 physicians were surveyed, and at least 3 of them reported they were fearful of being sued by this population. And so this at least demonstrates that the idea is out there of not wanting to, that physicians have reservations in treating this population. So the goal of my presentation is to address this perception that the poor patients are generally more litigious towards their doctors than others. The other is to look at some of the factors that discourage lawyers from actually filing medical malpractice lawsuits on behalf of low-income clients, contrary to the perception of an increased litigiousness among the poor. I want to review some studies that were done that point out the idea of an unconscious bias that may contribute to this misperception, and also review recommendations that have been shown to improve medical care and decrease the risk of malpractice lawsuits. The poor are actually less likely to sue. We have several studies that have negated this notion that low patients sue their doctor more often than other populations. And I'm going to be focusing on these 4. The most recent was did a literature search that's done reported in the Clinical Orthopedics and Related Research in 2012. There's also other studies that were one of the most relevant was the one published in JAMA in October 13, 1993. And that's a case control study of malpractice claims and socioeconomic with regards to socioeconomic status. And then also even what the government has done with regards to looking at improving access towards or for Medicaid patients and how many of those patients are actually suing physicians. So this first study, the one published in JAMA, was one of the largest, and it looked at 51 hospitals in New York State, and investigators looked at the relationship between patient socioeconomic status and the likelihood of filing a medical malpractice lawsuit. Authors found not only are patients in lower socioeconomic strata less likely to sue on the whole, but they are also less likely to file non-meritorious malpractice claims. They ended up looking for injury that was caused, like an iatrogenic injury that was caused, and they looked at 31,000 records from in New York in the year of 1984. And they found that poor patients had an odds ratio of 0.2, confidence interval of 0.03 to 0.8, and uninsured patients also had an odds ratio of 0.1, which were significantly less likely to file malpractice claims after controlling for severity of medical injury. And among patients who suffered medical injury, the elderly were also less likely to file claims. Gender and race were not independently associated with risk of malpractice claims either. There's another study that was done in Maryland and essentially looked at arbitration's office and to compare legal claims filed by Medicaid versus those filed by non-Medicaid patients, and no differences in the incidence of claims between these patient populations were found. And in this study specifically, 36% of all claims were filed by patients who enrolled in a Medicaid program only after the injury, or the medical injury itself, caused them to be to qualify for Medi-Cal or for Medicaid assistance. Interestingly, back in the 90s or so, the Office of Technology Assessment was an office of the United States Congress from 1972 to 1995, whose purpose was to provide congressional members and committees with the objective and analysis of complex scientific and technical issues. And they did an investigation in 92 that asked whether or not Medicaid and Medicare enrollees sue more frequently than other patients. And they found that although Medicaid patients represent 10% of the population at that time, they filed less than 5% of medical malpractice lawsuits. Also, monetary settlements related to medical malpractice lawsuits in favor of non-Medicaid patients were 5 to 10 times greater than those received by Medicaid patients. So based on those findings, the Office of Technology Assessment concluded there was no evidence to suggest Medicaid and Medicare patients sue more frequently than other patient groups. And this is one of the tables that you can find in that study. And essentially, they looked at total, populations that were made up by Medicaid patients. And only about, for example, in the GAO study, that was done in Washington, D.C., and only 5.8% of claims submitted were those by Medicaid patients, when the population was close to 10% at that time. So there's other limitations too for low socioeconomic patients to be able to even file a lawsuit. So poor patients wanting to file a medical lawsuit, they have to find a lawyer that's willing to represent a patient on a contingent fee basis and to advance the funds needed to litigate the case in the first place. Usually to even file a simple medical malpractice suit that goes to trial is approximately $20,000, and complex cases can cost a law firm in excess of $100,000. There's also contingency fee schedules that rely on a settlement or an award made on behalf of the client for the lawyer to be compensated for litigation costs. And the most common percentage for lawyers' fees range between 33 and 40% of the monetary recovery from the lawsuit. And if the client loses the case, the lawyer must bear the entire cost of litigation. Interestingly, just before coming here, I was able to see a patient, and in clinic who's a retired lawyer, and he told me that also a lot of practices have moved away from taking on small lawsuits because in the past a lot of insurance companies would settle first, and now they opt to actually go through trial to incur all these costs and to dissuade lawyers from picking up these type of cases too. And then interestingly, in this study that was done, published in Orthopedics and Related Research, they did a review of all the data that's been with regards to this topic up to, and it was published in 2012. They did a literature search, computer search, and they used a lot of terms like do the poor sue more often, Medicaid, and lawsuits. And ultimately, they proposed the idea that, the unconscious mind can trick a person to behave in an undesirable way. For example, physicians may have an unconscious desire to avoid treating poor patients out of concern related to insufficient financial reimbursement. And such physicians might consciously or unconsciously presume poor patients are more likely to sue as an excuse or way of avoiding the presumed difficulty associated with collections from such patients. So doctors may be biased against poor people for reasons entirely unrelated to the excuse or rationalization that such patients tend to sue more often. They also pointed out ways in which we can eliminate, this bias, or even eliminating the risk of being sued. And one of those ways to overcome the unconscious bias is to just be mindful of cultural differences. Also, do the best to not discriminate between patients, and be aware that there could be even perceived differences in between providing care based on different cultural backgrounds. Communication skills are effective remedy against the risk of litigation. Even I saw some literature that is pointing out how now we're using email, or even being able to connect through electronic medical records to respond back to patients actually improves communication, and so the likelihood of being sued decreases. And also empowering patients to become active participants in their own health care by giving them knowledge and education also helps decrease and mitigate this risk. Interestingly, I was able to find an article or a study that was done in Greece, and they actually looked for those that are more likely to sue. And they found that, this is actually done in a urological clinic, in a general academic hospital, and you looked at the outpatient setting, and they mostly gathered data through interviews by psychologists. And they found that those who are younger in age, who have weaker relationships with religion, don't see the doctor that often, or are in the outpatient status, are have higher expectations for information, were associated with higher possibility to consider suing their physician. And the outmost thing, or that they were concerned about, was if a mistake was made, they definitely wanted to know, and they appreciated being told right away that a mistake occurred. And they even felt that was more important than suing a patient or suing a doctor. So going back to that title screen, what we are seeing more and more is Medi-Cal patients suing the state as a whole, claiming there's widespread discrimination against them that limits their ability to actually be able to find physicians that are willing to take care of them because of the differences, mostly out of financial limitations, with them not reimbursing as much as Medicare and those other and commercial insurances. It's interesting that you can have a perspective, or at least have a thought in passing that may push you to say, well, this population is tougher to care for, or may have more complications, but in reality they need help and they're less likely to sue you. They may be more grateful at times, and so it's interesting that as a whole they're moving more towards requesting more assistance, having the willingness, finding physicians that are willing to care for them. And this slide was done before, but interestingly, just yesterday we got an email from the California Medical Board that they've actually passed a proposition, I think it was 52 or so, that has allocated $220 million for recent physician graduates who are willing to take care of Medicaid patients that will go towards loan repayments. So that's something that everybody should consider looking into, because that should at least help motivate more physicians to help take care for this population. Those are my references.
Thanks. All right. Are there any questions or comments?
Yeah, I never thought the socioeconomic disadvantaged individuals sue more, but there's no question it's more difficult taking care of a population that has more difficulty accessing medical care, often with communication problems. So it just adds to the difficulty on top of the poor reimbursement that's often associated with it. So I think that sets up a problem in our minds, and you're almost biased going in sometimes seeing the patient. You have to remind yourself it's not the individual's fault necessarily, it's our responsibility to do the best job we can given this situation.
I agree. Yeah.
I appreciated you citing that 4% of those outside of this population that you were looking at, because of weaker religious affiliation, would be more tempted to sue. So this is a case for spiritual care in the context of this is real hard data. So thank you very much.
All right. If there are no other comments, is it a myth poor people sue for malpractice more often than others? So how many think that this is true? Poor people do sue more often? How many think it's plausible? How many think it's busted? Everybody. All right.